According to the Substance Abuse and Mental Health Services Administration, nearly 1 in 5 Americans suffers from mental illness each year. Joining me in the studio today to discuss the Peace River Center's Crisis Response Team program is Kirk Fasshauer, Director of Crisis Services. Kirk, welcome to Polk Place.
Good morning, thank you.
Glad to have you here. Now, you're here principally to talk about the Crisis Response Team. I understand it's a mobile unit, it's located in Bartow, and it can be dispatched anywhere in the county. Could you provide me some more details?
Sure. The Crisis Response Team has been in existence since 2002, and they're responsible for 4 functions at the crisis services at Peace River Center. We have a 24-hour crisis line, which is 519-3744, and basically that's open to anybody in the Tri-County area, Polk, Hardy, and Highlands County, to call and talk about anything. Essentially, it's a general crisis line, so it's not like a true hotline. And what I mean by that is, as far as the general crisis line goes, we get calls for information referral, like, hey, do you have a number to this service? Yes, we do. Here's the number. Thank you very much. And that's kind of an information referral kind of a call, all the way on up to the more serious types of calls where they're either suicidal or psychotic, and then the counselors on the phone have to walk them through a process and hopefully de-escalate the situation. Sometimes we have to call out law enforcement if the situation is really bad. The other function that Crisis Response Team has is they've got an area where they're open 24/7 here in Bartow, and so there's a lobby that's open 24 hours a day. So it's a walk-in clinic. So essentially somebody could walk into the Bartow location of our Peace River Center outpatient services, and they can ask to speak to a crisis counselor then. So CRT does that crisis assessment. The third function that they have, which is really the big piece, is that the Crisis Response Team is a mobile team. So the crisis doesn't need to come to us, we can go to it in the community. So we can go to people's homes. Sometimes people call through the crisis line and say they really need to talk to somebody, and the counselors will ask them or give them that option, would you like to speak to somebody in person? And they can go out to the home and talk with that individual and come up with a crisis plan, do a crisis assessment, and hopefully divert things from getting worse, and divert from getting into an inpatient hospital setting, because the beds are limited in our county, so we try to help them get connected to services. So we've people's homes, we've been to doctors' offices, local businesses, Winn-Dixie parking lot, wherever that person wants to meet us.
Right. And I neglected to add that you service Polk, Highlands, and Hardy County. That's a pretty large area.
It is.
So typically, when somebody calls and you respond with this crisis response team, this mobile response, I would guess it's the nature of the situation that maybe dictates the response time. But could you take me through like a typical call? Sure.
Somebody could call in and say that they're feeling a bit depressed and they're not really sure about what to do, and they've had maybe some vague thoughts of wanting to hurt themselves. Counselor can offer to go to the home or come out to see them. And so what they'll do is they'll leave from our Bartow location. They get dispatched from there, and then wherever they are in the county. Now, we don't exactly cover Hardy County on the mobile response. We cover Polk and Hardy. So we'll go, and a lot of our calls have been in Polk. We do get a few calls per year from the Hardy County area. So we'll go out to the home, and then the counselor will talk with the individual about the situation and what's going on for them. And they are afforded the opportunity to take as much time as it needs to in order to help that person resolve their current situation. So they can talk about other options that may be available to them, help them get connected to various services, not only with Peace River Center, but with local county government to get connected to financial help. Again, it depends on what the crisis is. Sometimes it could be outpatient services, and what that involves is helping the person look at what's your financial situation, if you have insurance, where does that cover? because some places take insurance, some insurances versus another, and so we don't want to point somebody in a direction and that not work out for them.
I would imagine there's probably some kind of preliminary assessment with, let's say, the initial call, that intake, that prepares the actual person that's responding to the person in crisis.
Correct. Yes, over the years we've learned that we ask a few questions and find out what's going on, and if it's the person kind of hangs on to the phone a little bit longer, we'll offer, hey, would you prefer to speak to somebody in person? And then what the counselors do is check for safety, because they're going out into the community and it can be a little unsafe. Sure. And sometimes we will ask law enforcement to assist us in just making sure it's safe for us to be there. An
abundance of caution.
Yes, absolutely, yeah. Absolutely. And there have been a few times when we've had a counselor go out and the area doesn't look all that safe, and so they call back to the office and they say, I'm not so sure about this, and it's like, okay, well, we can call that person back and let them know, could we meet somewhere else? And because we have different locations throughout the county, we sometimes will offer to meet at another location.
Now, the staff that handles this type of crisis response, this team of yours,
yes,
do they have any specialized training that might differ from the other services that you provide? Well,
they're bachelor level and master level individuals, and then they get an additional 145 hours of training specifically geared for crisis. They part of that time, a lot of that time is shadowing, but they get specific training in how to handle the crisis call, how to work the phones, and then suicide assessment. They're very adept at asking questions around suicide and lethality and things like that, so that they can better direct the situation. In most suicide situations, we can work a safety plan, but there are times when we have to up the ante and get that person the help they need immediately. So we will ask for the assistance of law enforcement in the community to come by, because if we end up having to do a Baker Act, which is the involuntary commitment process here in Florida, if we have to do that process, we'll eventually have to call law enforcement to come out and provide transportation anyway, because we cannot transport anybody in our vehicles. So they'll come out. So what we've done is partner really well with a lot of local law enforcement to help us with that process. They may initiate the certificate based on our assessment, and then they drive the person to the nearest receiving facility.
Well, it's certainly good that you have that partnering. Now, the educational background of your staff.
Yes.
I'm guessing social work, behavioral psychology.
Yes.
Typically, what kind of education does your staff bring to bear, let's say, on handling these types of situations with the crisis response? I mean, I know you mentioned the specialized training,
right,
but obviously they have to have some kind of fundamental or
correct,
foundational background.
Yeah, what I look for is people with mental health counseling, psychology, social work. Those are kind of key areas, because those bachelor level and master's level. Bachelor level has that foundation of the counseling experience and the additional training you get through that educational process of theory and how to engage in a counseling process. Master's levels just bring it to that next level of additional theory, but more practice, hands-on kinds of things.
Okay, so let's go to the other end now,
yeah,
the resolution.
Yeah.
So the crisis response team arrives at the house, okay, you know, they discuss matters with the individual, you know, they resolve, I don't imagine they resolve the crisis necessarily at the time that they arrive. I
right,
suspect there may be a process beyond that that's involved as well.
Yes, there is, and we do some follow-up. So we go out and visit, we do the initial assessment and present some options, and we come up with a crisis plan, basically. And so we would work with the individual to say, okay, here are some options for you. I'm going to follow up with you tomorrow or a couple of days, again, depending on the crisis situation. It might be getting connected to some outpatient services, so we'll initiate that process. And again, we're 24/7, so at 10 o'clock at night, there's not a lot of people to contact to set up the appointment, but we can make those contacts in the morning and then follow up with the individual to make sure that that happens. And we'll do some follow-up until they get connected and they feel that the situation is resolved.
I neglected to ask, how long has this crisis response team been in place? How long has this service been available?
This has been available since 2002, so it's about 13 years.
Okay.
13 years now.
So I would guess that it's been successful because it
has
certainly lasted this long.
Yes, it's been quite successful. I think part of that success has to do with the partnership that we've had with folks in the community, especially law enforcement. Part of why the CRT exists is to be that partner with law enforcement, because they are the ones that get called when they have somebody who's acting a little bit bizarre in the community. And if they are not able to determine that this person meets Baker Act criteria, but they kind of know they need something, because law enforcement they're waiting for those magic words
Sure.
in order to initiate the Baker Act. And if that doesn't happen, they're like, well, this person needs something. They have the option to call crisis response team to come out and do a further evaluation. So that's been very successful.
So it's kind of like a collaborative process on occasion with the law enforcement.
Correct.
Or maybe they rely on your expertise for some guidance into how to handle the situation, whether it's diffusing it, like you say, whether it requires Baker acting, or removing the person from the home, or
Right.
I guess diffusing the situation. So in a lot of respects, they kind of rely on your assessment, your opinion of things.
Yes, yes, they do, and we're able to give them our assessment to help them kind of reinforce some of the decision making that goes behind what they do.
Sure.
And that's been very useful. And they also understand that we're going to do that follow-up process. We're just not going to go visit that person one time and just leave them out there. We'll make a follow-up phone contact. Sometimes it's face-to-face, just to make sure they're continuing to do okay.
So I'm sure there's been some relations established between you and I guess the Polk County Sheriff's Office.
Yes.
Does it involve the municipal police departments as well?
There are a few that know about us and use us quite a bit. Yes.
Fantastic. Are there any other services that you'd like to let the folks know that you provide?
Well, Peace River Center has several various programs, and we basically run the gamut in mental health. We've got several locations throughout Polk, Hardy, and Highlands. We offer outpatient services. We have crisis services. When I say outpatient services, I'm talking outpatient counseling as well as psychiatric services, where people see a doctor to get medications if they need that. We have case management services for adult and children. We've got programs like the CAT team, which is a children's assertive team. That is a team that works intensely with children that are at high risk of out-of-home placement or going into inpatient care.
These are children and adolescents?
Children and adolescents, correct. They also have the adult FACT team, which is another team that works with individuals with severe and persistent mental illness who, if this team wasn't around, would end up coming into a crisis stabilization unit, which is also a service we have as a crisis inpatient unit. We also have the short-term adult residential treatment program. We call that the SRT, where it's one of the steps in the process of crisis work, in that you've got the crisis response team that works to try to divert folks and help them get connected to the community, but then we have our crisis stabilization unit that if people need that level of care, they can go there for an evaluation. And once that evaluation process happens, if it's determined more restrictive kind of setting is needed for a little while, we've got the short-term adult residential treatment program. And then the next level beyond that is the most restrictive kind of setting, which is state hospital. So a lot of people at SRT are awaiting state hospital bed, but we work with them in that program to try and divert them from state hospital as much as possible.
Now, I understand the Peace River Center is a private, not-for-profit community mental health organization.
Correct, yes.
Now, are there fee-based services? Where do you get your support?
Well, we've got various funding sources. We have contracts with managed care insurances, but we also get a large portion of our funding from the substance abuse and mental health with the state. So we have a contract with them to provide care for individuals who don't necessarily have insurance, the indigent. And it's a contract. It's like at the CSU, for example, they pay for a certain number of beds. We have a 30-bed unit, so they'll pay for a portion of those beds, while other beds we have contracts with other managed care companies.
And you have a lot of community partners. I
Correct.
understand the Polk County Board of County Commissioners is a partner. I would assume Highlands and Hardy County probably have similar
Yes, they do.
arrangements through
Yes,
their
they do.
boards of county commissioners.
Absolutely, and it's been a good partnership over the years with all three of the counties utilizing our services.
Right. Do you accept donations from the community?
Yes, we do. If you go to our website, which is peacerivercenter.org, there's a button on our website that says if you'd like to donate, please do. We also have a thrift shop. It's located in South Florida Avenue, South Lakeland area, and people can bring their gently used items to that location. That's always been very useful, and it's been quite successful in getting clothing and sometimes some furniture. I think they take as well, and that helps the community for inexpensive clothing, but it also helps some of our clients as well.
Well, you're certainly providing a much needed, service to the community. Like we said at the beginning of the program, nearly 1 in 5 Americans likely suffers a diagnosable, mental health issue in any given year. So, and I'm sure that needs reflected here locally in Polk County as well.
It is, and we stay busy. I like to tell people when you typically see somebody, they say, "Well, how's it going? Are you staying busy?" And it's like, "Yeah." And then unfortunately, if I'm staying busy, other people aren't doing so well.
Right.
So glad to be here to help the community as much as possible.
And what size staff does the Peace River Center maintain?
Well, we have I want to say over 400 individuals.
Wow.
And again, it's spread out, so we're not all in one location. We've got some offices here in Bartow. We've got some offices up in Lakeland. We've got several offices in Lakeland. We've got folks in various locations with the Department of Health as well. We've done some partnering with them. We have a wellness clinic in our Gilmore office, which is North Lakeland. That's an integrated health process where we've partnered with a little bit with Lakeland Regional to provide primary care as well as the behavioral health care services. And then we've got offices in Wauchula and Sebring where we see folks. So quite a spread.
Well, a staff of 400, that's obviously representative of the need here locally.
Yes.
So that provides some perspective. I'm really surprised that your staffing is that high. So obviously there's a need here, and I'm sure the folks at the Peace River Center are doing great work here in the community, and certainly probably are very deserving of the support that you receive. So,
thank you.
Kirk, thanks for joining us today. We certainly appreciate the time that you spend here to discuss the crisis response team and your other outreach services you and your staff at the Peace River Center provides to the people of Polk, Highlands, and Hardy counties.
Thank you.
The Crisis Response Team is a mobile outreach service. It's designed to provide immediate crisis assessment, crisis intervention, and counseling, linkage and referral and crisis follow-up contact to promote resolution for individuals, that's adults and children, experiencing any type of emotional crisis, which can include suicidal intentions, self-destructive behaviors, or acute, severe, and intense emotional distress. Services also include suicide prevention awareness, critical incident stress debriefing, and stress management. To learn more about the Crisis Response Team or other programs offered by the Peace River Center, visit them at www.peacerivercenter.org or give them a call at 863-519-3744 or toll free at 800-627-5906.